Welcome to another video on neuroanatomy. In this video, we are going to learn about the cranial nerves. How can we learn about the cranial nerves? The best way to learn about the cranial nerves is by looking at the ventral view of the brain. That is what you are seeing here, in which you are seeing the cerebrum here, the cerebral lobes. This is the midbrain. This small part that you see is the midbrain, and this is the pons, and this is the medulla. So this ventral view gives you a very good idea about how the cranial nerves enter or exit from the brain surface. So the points that we are going to learn are the cranial nerve numbers and the cranial nerve names. So it is very important for you to correlate the number and the name. That means that you know that there are 12 pairs of cranial nerves. So when you are asked which is the cranial nerve number 8, or which is the vestibulocochlear nerve, or which is the trochlear nerve, you have to correlate the number and the name, because we will interchangeably use these in our case presentations, in our discussions, in our classes. So it's very important to correlate the number and the name. And next we will learn most importantly about what is the location of this cranial nerve in the brainstem. And this is very crucial, even if you are taking an anatomy exam, or when you are assessing a patient and you are understanding one cranial nerve is involved. In order to locate that, whether it is a lesion in the brain, in some part of the brain, then you have to understand which is the location of the brain from which this cranial nerve is emerging from. So we will learn about the cranial nerves, as I said, in the ventral view. So this bigger picture that you're seeing here, that is a more zoomed view of this region, this ventral part. Okay, so this is the brainstem, which houses the nuclei of the cranial nerves number 3 to 12. So numbers 1 to 12 are the cranial nerves. Of these, 3 to 12 are housed in the brainstem. So we need an enlarged view of the brainstem to understand that better. So coming to the topic proper, we will first learn the numbers, then we'll learn the names. So to understand the number and the name, it is very helpful if you have a mnemonic. So you may have many mnemonics when you learn about the cranial nerves. The one that I use, which one of my teachers had taught me, is based on the first letters of the names of the cranial nerve. So I'll write down the mnemonic first. You have 3 O's and 2 T's. Next you have an A. Next you have F. The next, in the mnemonic, it is called A. Next G, V, A, and H. Okay, so it's important to put a word to sound it. It is called OOO-TTA-FAG-VAH. Okay, 3 O's and TT, OOO-TTA-FAG-VAH, FAG-VAH. So that is a mnemonic, and it's very important to correlate the name and the number, and don't get confused, because you have a lot of O's, you have a lot of T's, you have a lot of A's. So don't get confused between these. So we'll systematically learn these names. So I'll write it down. The first one is olfactory. Olfactory nerve, as you know, olfaction is a sense of smell. Okay, and the next is optic, OPTCI, OPTIC. So the first two, we can remember that you have one nose and you have 2 eyes. So one is cranial nerve number 1, olfactory, is concerned with smell, and 2 eyes, optic. So optic is concerned with vision. It's very important to remember that optic nerve is concerned with vision only, because you have another nerve that we'll learn later called ophthalmic nerve, and as we know that ophthalmologists are concerned with eye, you may get confused. Ophthalmic nerve is concerned with vision. No, the nerve of vision is the optic nerve, or the second cranial nerve. And the next nerve is oculomotor. So this clears out the 3 O's. Okay, so you have olfactory, optic, and the next is oculomotor. Next you have a T. That T is trochlear. Why these are named so, we will learn that detail when we learn about each of these cranial nerves. And the next T is trigeminal. Why it is called trigeminal? Because it has 3 branches, of which one is called the ophthalmic nerve. Ophthalmic, maxillary, and mandibular are the branches of. So it has 3 divisions. That's why it's called trigeminal nerve. The next is abducens. At this point itself, let me just mention that we usually learn 3, 4, and 6 together, because these 3 nerves are concerned with the eye movement. So we examine also these 3 nerves together, 3, 4, and 6. And the next nerve is the facial nerve. Facial nerve. So that is OOO-TTA-FAG. Okay, the next nerve, according to the mnemonic, it is auditory, but actually it should not be called auditory nerve, it should be called the vestibulocochlear nerve. But we are not changing that mnemonic for the the easy memory aid purpose. It is called vestibulocochlear. It's very important to know that it has a vestibular part and a cochlear part. The cochlear part is concerned with hearing. Vestibular part is concerned with balance and our head movements and stimuli related to that. So that is why it's called vestibulocochlear, and it should not be called auditory nerve. In lower classes, we may have learned it as auditory nerve, but from in medical school, we learn it only as vestibulocochlear. And the next is glossopharyngeal, and the next nerve is vagus, and the next nerve is accessory, so that is a second A, and the next is hypoglossal. So the first task that I want to assign is you have to know the name and the number. Whenever you are asked what is the cranial nerve number 8, you have to say it is vestibulocochlear. You are asked cranial nerve number 12, you have to say it is hypoglossal. When you are asked which is trochlear nerve, you have to say it is 4. So always this part should be very clear. The number and the name should be extremely correlated in your brain. So take a while, even take a few days to memorize the cranial nerve numbers and the names. For that, a memory aid, a mnemonic will be very useful, and this is the mnemonic that I use. You can use any mnemonics that you want. There are a lot of them available in the internet. So next we are going to, from which part of the brain this are arising from, or which is the part of the brain where this is attached to. So that is a place where we are going to use this picture also. For the ease of understanding, I'll first say that the cranial nerve number 1 and 2 are attached to the forebrain. It is attached either to the cerebrum or to the diencephalon. Okay, so that is cranial nerve number 1 and 2. So first we'll look at cranial nerve number 1. Cranial nerve number 1, you actually can't see the cranial nerve number 1. 1 is actually a 20 fine olfactory nerve rootlets that pierce the cribriform plate and entered into this structure. This is called the olfactory bulb. Okay, this is the olfactory bulb. So it reaches there. They are very fine nerve rootlets. So you call it as olfactory nerve rootlets. From there, you have the olfactory tract arising backwards. This is the olfactory tract. The olfactory tract goes backwards and it divides into two striae, olfactory striae. So that is cranial nerve number 1, but that is not reaching the brainstem. That is going directly to the cerebrum. And the next is cranial nerve number 2. So this is cranial nerve number 1. The next is cranial nerve number 2. Cranial nerve number 2 is this nerve. The cranial nerve number 2, very characteristically, it decussates, it hemidecussates. That is called the optic chiasm. Because of the decussation, the two nerves comes and joins. A few fibers will interchange there, and the rest will go behind as optic tract. So optic nerve, optic chiasm, and the optic tract. That is the cranial nerve number 2. The cranial nerve number 2 goes directly to the thalamus, to the lateral geniculate nucleus of the thalamus. So these two nerves are not attaching to the brain stem. So due to that reason itself, these two are often said that they are not cranial nerves. So from 3 downwards are the true cranial nerves that we usually discuss. The third and the fourth nerve arises from the midbrain. As I said in the first slide, we are particularly interested from which part of the brain the main nuclei are, what is a part of the brain that this nerve emerges from. So 2 nerves, 3, 4 emerges from the midbrain. They are related to the midbrain. From 5, 6, 7 and 8, together we learn it with the pons. Okay, the main nuclei of these are located in the pons. At this point, at the outset, let me say that all the nuclei are not located in the pons. A few nuclei are located a little bit in the medulla, a little bit in the midbrain, but that we'll come to that detail later. But on a general rule, you can remember that the 3, 4 cranial nerves are located in the midbrain. The 5, 6, 7, 8, the rest 4 nerves, 5, 6, 7, 8 are located in the pons. And the next 4, that is the 9, 10, 11 and 12. The 9, 10, 11 and 12 are related to the medulla. Here also there is a little bit of exception. The accessory nerve is actually arising from the spinal cord. So that is truly exactly not coming from the cranium itself. It is coming from the upper cervical spinal cord. So there is a little bit of exceptions here and there. But as a general rule, you can learn that the first 2 nerves, cranial number 1 and 2, are not True cranial nerves, they are attaching to the forebrain or the prosencephalon, which has the cerebrum and the diencephalon. And next, you have the third and fourth cranial nerves in the midbrain. 5, 6, 7, and 8, the next 4 in the pons. 9, 10, 11, and 12, the next 4 in the medulla. Okay, so this is very, very useful when you are learning about a cranial neuropathy, or we are learning about a trauma, or we are learning about a stroke that happens in the medulla or in the pons or in the cerebrum. We need to know where these nuclei are located to assess it. So let us identify these cranial nerves. We identified cranial nerve number 1 and 2. Okay. Next, we are going to 3 and 4. Cranial nerve number 3 and 4 is located near the midbrain. So as we know, this is the midbrain. This shaded part is the midbrain. So cranial nerve number 3 is arising from the medial part of the crus cerebri. So this is the cranial nerve number 3. Okay, so this is the cranial nerve number 3. It is arising, if this is the 2 crus cerebri, they are arising from the medial part. It is very important to know that they are arising from the medial part. So that is the cranial nerve number 3. The other name is oculomotor nerve. Okay. The trochlear nerve, the cranial nerve number 4, is also in the midbrain. It arises a little bit in the lower part of the midbrain. It is very important to learn that cranial nerve number 4 is unique. It is arising from the dorsal aspect of the midbrain. It is arising from the dorsal aspect, and it decussates dorsally and it comes ventrally. So what you are seeing here is the ventral part of the cisternal segment of the trochlear nerve. So this is the trochlear nerve. So we completed cranial nerve number 3 and 4, and always remember 3 and 4 are located in the midbrain. So any lesions of the midbrain, there is a tendency for third nerve or the fourth nerve to get involved. We come to that later when we learn about the midbrain and the clinical syndromes that affect the midbrain. Next, we are going to the pons. This is the pons. As we know, it's a large structure and often the most common structure that is asked in brainstem and anatomy exams, especially in spotting exams. Around the pons, you have 5, 6, 7, and 8, the next 4 nerves. In this, you have to know where these are located. The fifth cranial nerve is located on the lateral aspect of the pons. Okay, or this is the location of the fifth nerve, which you have 2 nerve roots for the fifth nerve. This is the motor root. This is the motor root, and this is the sensory root. The sensory root is large. The motor root is usually small. So that is the trigeminal nerve, and trigeminal nerve is classically located a little laterally in the pons, and the part that is lateral to the trigeminal nerve is classically the middle cerebellar peduncle that connects the cerebellum. So actually, that is the reason why this is called the pons. You know that pons, the word means bridge. So this is the bridge that is connecting the 2 cerebellar hemispheres. It looks like it connects the 2 cerebellar hemispheres. We will learn what this bridge is actually made of later. But for the time being, you understand that this part, the trigeminal entry zone, this is called the trigeminal entry zone, and that part is located at the junction between the middle cerebellar peduncle and the ventral part of the pons. And next, we are going to the 6, 7, and 8 nerves. 6, 7, and 8 are located in the pontomedullary junction. That is, this is the pons and this is the medulla. So between that, you have the 6, 7, and 8. So this one is the 6th nerve. 6th nerve is the one that I am shading now. This is the 6th nerve. So 6th nerve, always remember, 6th nerve is medial. As we learned before, the 3rd nerve was medial. So the 3rd nerve is medial in the midbrain. The 6th nerve is medial in the pontomedullary junction. Next, you have the 7th nerve. This is the 7th nerve. Some descriptions are the 7th nerve has actually 2 roots. This is the 7th nerve, and this is called a smaller nerve that you can see here. That is called the nervus intermedius. The nervus intermedius is classically sandwiched between the 7th nerve and the 8th nerve. This is the 7th nerve. So I'll just zoom this out here. This is the 7th nerve. You have a small nerve here, that is the nervus intermedius, and this will be the larger 8th nerve. So the intermediate nerve, or the nervus intermedius, is between the 7th and the 8th. And the next is the 8th nerve, which is just the vestibulocochlear nerve. So as we learned before, 5, 6, 7, and 8 were grouped together under pons. But still, we have to know that pons, only on the surface of the pons, you have only the trigeminal nerve. The 6, 7, and 8 are located actually in the pontomedullary junction. Next, we are going to 9, 10, 11, and 12th nerve. So for that, again, we'll go to the medial aspect. This is the medial aspect on which you have a series of nerves that are emerging out. Can you see these nerves emerging out, and these nerves typically has a lot of roots. Okay, these roots are arising from the ventral aspect of the medulla. Specifically, it is between the pyramid, which is the ventral swelling of the medulla, in the upper part. This swelling is called pyramid, and laterally you have another swelling that is called the olive. We can't see the olive here because of these nerve rootlets. This is the olive. Okay, this is the olive, so this is the pyramid. So between the pyramid and the olive, or the pre-olivary sulcus, that is the location where you have the hypoglossal nerve rootlets. So the hypoglossal nerve rootlets are again most medial. So here you can see a pattern: the third nerve, the sixth nerve, and the hypoglossal nerve. 3, 6 and 12 are most medial nerves. In reality, actually the fourth nerve is also most medial, but the fourth nerve is exiting on the dorsal aspect, so we can see it from the ventral view. So the third, fourth, sixth and 12th are actually the most medial, and this is very important when we learn about the cranial nerve nuclei. Posterior to the olive, you have the ninth cranial nerve. This is the ninth cranial nerve, and this are the vagal nerve rootlets. So all of them are arising behind the olive. So this is cranial nerve number 9, and this is cranial nerve number 10. And below that you have the accessory nerve. This is cranial nerve number 11. Accessory nerve, as I said before, is strictly not coming from the brain. It is coming from the spinal cord, the upper spinal cord, and that is why it is called the spinal accessory nerve. Now there is a little bit of confusion in the accessory nerve. Some say that there is a cranial accessory nerve and a spinal accessory nerve together forms the accessory nerve, and then it divides, and the cranial accessory joins the vagus and the spinal accessory continues. There is another separate video that I created on this confusion, but for all practical purposes, you know that the accessory nerve is coming from the upper part of the spinal cord, and it innervates the sternocleidomastoid and the trapezius. So that though it is called a cranial nerve, it is actually arising from the spinal cord, from the upper cervical spinal cord. So that is what you are seeing here. These rootlets, these roots that you are seeing here are the accessory nerve rootlets coming from the spinal cord, and they are emerging out and together forming the accessory nerve, and they will enter through the foramen of magnum and then exit out through the cranial, through the jugular foramen. All the foramina through which these cranial nerves are exiting have been discussed in another video, that is the base of skull foramina. So in that video, I've discussed where these cranial nerves exit. So take home point of this video is that know the numbers, know the names, correlate them in and out. It should be very, very clear, correlating the name and the number. And next you have to know which part of the brain these are attached to. 1 and 2 are not true cranial nerves. They are attached to the cerebrum or to the diencephalon. 3 and 4 in the medulla. 4 is unique. It is coming from the dorsal aspect. It decussates and it exits out lateral to the midbrain. The 5, 6, 7 and 8 are mainly located in the pons. The 5 on the surface of the pons that you are seeing here. The 6 on 7 and 8 are the pondomedullary junction. The 9, 10, 11 and 12. The 9, 10 and 11 are coming like a series from above downwards behind the olive in the post-olivary sulcus. In the pre-olivary sulcus, you have the hypoglossal nerve rootlets. That is the cranial nerve number 12. So we'll see in the next video. Thank you.